Okay, let's dive in. Today, we're plunging into a topic that weighs heavily on so many people, type 2 diabetes. It's often presented as this relentless downhill slide, something you just have to manage as it gets worse. But the source we're exploring today, it really challenges that deeply held belief.
Yeah, it does.
Our guide for this deep dive is How to Reverse and Prevent Type 2 Diabetes, the Quick Start Guide by Dr. Jason Fung. And right from the start, there's this powerful idea that conventional wisdom might have actually failed us. And the path forward isn't necessarily revolutionary in terms of brand new science, but perhaps revolutionary like returning to some older ideas, focusing squarely on treating the root cause, not just patching up the symptoms.
And what's particularly interesting about this book is how it meticulously lays out the groundwork. It helps us understand exactly what this disease is, why our current approaches often don't quite hit the mark. And then, perhaps most surprisingly to many, it presents a compelling argument for how type 2 diabetes could actually be preventable, and maybe even reversible using natural methods, primarily centered around, well, dietary strategies.
So our mission here is clear. We're going to unpack this book's core argument. We'll extract the most important insights about how type 2 diabetes just exploded into the epidemic it is today. We'll get a really clear picture of what's happening inside the body according to this perspective, understand why common treatments might be missing the point, and then dig into the alternative strategies the book champions. Get ready, because this dive is going to challenge some long-standing beliefs about health and medicine.
Definitely.
So let's start by just grasping the sheer scale of this. The book paints a picture of a catastrophic, almost sudden rise in type 2 diabetes. It went from being quite rare just a few decades ago to now affecting, astonishingly, roughly half of adults worldwide if you include prediabetes.
Half. It's incredible.
Think about that 1 in 2 adults. The numbers are truly shocking. Like the statistics cited about China experiencing an incredible 1,160% increase in diagnosed cases since 1980.
Wow.
That's not a slow trend. That's, well, an explosion.
And it's not just about abstract numbers on a chart, right? It's about the profound impact on individual lives. The book strongly emphasizes what it calls the whole body effect.
Yeah.
What's remarkable and frankly devastating here is that type 2 diabetes isn't confined to just blood sugar or a single organ system. According to the source, it infiltrates virtually every cell in the body, causing pervasive long-term damage that's described with a very stark word: rotting.
Right, rotting. And the book doesn't shy away from detailing the truly horrific complications that can result from this systemic damage. We're talking about blindness, kidney failure, often requiring dialysis, heart attacks and heart failure becoming significantly more likely.
Yeah, the stats are scary.
Stroke risk increasing dramatically, cited as 150 to 400% higher. Diabetic neuropathy causing nerve damage and pain, often in that classic stocking and glove pattern.
Yeah.
Peripheral vascular disease that can lead to limb amputations, fatty liver disease becoming incredibly common.
And even potential links to cognitive decline like Alzheimer's and infertility issues, particularly tied to conditions like PCOS. It's a breakdown across multiple systems.
Exactly.
This reality prompts a crucial question that the book raises. If our medical understanding and the treatments we use for this disease were truly improving, shouldn't we be seeing these severe complications decline?
You'd think so.
The fact that they're actually becoming more prevalent and severe, despite centuries of research and massive healthcare spending, strongly suggests, as the book argues, a fundamental mismatch. We seem to be treating the superficial problem, high blood sugar, rather than the deep underlying cause.
And speaking of understanding the disease itself, the book makes a really important point distinguishing type 1 and type 2 diabetes. What's the core difference highlighted in the source that's key to their argument?
They are described quite pointedly as polar opposites. Type 1 diabetes is an autoimmune disease. The body's immune system attacks and destroys the cells in the pancreas that produce insulin, leading to a severe lack of this vital hormone. Treatment involves replacing that missing insulin.
Right, insulin replacement.
Type 2 diabetes, on the other hand, is characterized by having too much insulin circulating, a state called hyperinsulinemia, coupled with cells that are resistant to its effects, insulin resistance.
So high insulin.
Very high. The book finds it profoundly counterintuitive that we primarily treat both conditions by giving more insulin, especially when type 2 is already defined by an excess of it. The causes are fundamentally different, so the cures or treatments should probably be different too.
Right. Makes sense. Now, the book draws a very direct line between type 2 diabetes and obesity, even using the term diabesity to underscore how intertwined they are. It also suggests that the simple calories in, calories out model for obesity isn't telling the whole story. What's the central idea connecting weight gain to type 2 diabetes in this source?
Well, the book points to significant research, like studies from Dr. Walter Willett's group, showing a dramatic increase in type 2 diabetes risk, even with relatively modest weight gain. But it goes further. It's not just about the number on the scale or your BMI. The distribution of that fat is critical.
Ah, where the fat is.
Exactly. Visceral fat, the fat stored deep inside the abdomen, wrapping around your organs, is presented as a far more powerful predictor of type 2 diabetes than overall weight. The anecdote about Dr. Michael Mosley getting an MRI scan showing significant internal fat even when he didn't appear extremely overweight externally really hammers home this idea of hidden fat being a major player.
Okay, let's really unpack this concept of insulin's role and what insulin resistance truly means in the book's view, because this is where the paradigm shift happens. We usually think of insulin as the helpful hormone that unlocks cells to let glucose in for energy, but the book reframes insulin resistance completely. How does it explain what's actually happening?
Yeah, forget the idea of a broken lock and key or cell starving. The book introduces the overflow phenomenon paradigm.
Overflow phenomenon.
Okay, imagine a cell that's already stuffed to capacity with both glucose and fat. Think of it like a storage unit that's completely full, or maybe an overinflated balloon.
Got it. Packed full.
Insulin arrives, giving the signal, hey, take more glucose. But the cell resists this signal, not because the lock is broken, but because it simply has no more room. It's overflowing. This resistance means glucose stays in the bloodstream, leading to high blood glucose. In a desperate attempt to force the sugar in, the body's pancreas churns out more and more insulin, resulting in very high circulating insulin levels, hyperinsulinemia.
Wow.
So in this model, insulin resistance is actually a protective mechanism, a natural defense by the cell to prevent being poisoned by taking on even more toxic sugar and fat when it's already full.
So the cell isn't starving, it's overloaded and just saying, no thanks, I'm full. And the book makes a pretty provocative claim based on studies that administering insulin can actually cause or worsen insulin resistance.
That's right. The source cites studies where healthy individuals receiving continuous insulin infusions quickly developed insulin resistance.
Really?
Yeah. This aligns with a fundamental biological principle discussed in the book, the body's tendency to develop resistance to a constant high-level stimulus. It's analogous to how bacteria develop antibiotic resistance, Persistent exposure leads to a reduced response. High persistent exposure to insulin, according to this perspective, drives insulin resistance.
So if the cells are full and resisting, where does all this excess glucose and the fat end up going?
It gets stored abnormally, particularly in organs that aren't designed to hold large amounts of fat, what they call ectopic fat accumulation. The liver is a prime example.
The liver, okay.
When the liver is forced to process excessive glucose, and especially fructose, it rapidly converts it into fat through a process called de novo lipogenesis, or DNL. If it can't export this fat efficiently, it gets stored within the liver itself, causing fatty liver disease or hepatic steatosis, which is strongly linked to insulin resistance.
And that's becoming super common now, fatty liver disease.
Exactly. The book connects this to a fascinating historical observation by Dr. Samuel Zellman back in 1952, who noted fatty liver in a patient who consumed excessive amounts of soda, not just alcohol.
Interesting. And the book puts a significant amount of blame specifically on sugar, particularly fructose, for fueling this overflow and resistance.
Yes. While all refined carbohydrates cause spikes in blood glucose and insulin, fructose is highlighted as particularly problematic.
Why fructose specifically?
Well, the source explains that fructose is metabolized primarily by the liver, and unlike glucose, this process doesn't have the same feedback mechanisms or brakes. It's converted directly into fat DNL very efficiently, even without a significant insulin response. Plus, fructose doesn't trigger satiety hormones in the same way glucose does.
Ah, so you don't feel full.
Right, making it easy to overconsume massive quantities without feeling full. The book uses vivid analogies here, like how ducks or geese are force-fed high-starch corn mash to rapidly produce fatty livers for foie gras.
Oof.
Or how corn feeding finishes cattle by increasing intramuscular fat marbling. These are stark examples of how carbohydrate loading can drive fat accumulation in unexpected places.
Okay. Given this perspective that type 2 diabetes is essentially a disease of insulin resistance driven by too much insulin and excess sugar-refined carbs, The book takes a hard look at the standard medical treatments. It argues they often target the symptom high blood sugar instead of the underlying cause. Let's start with the most potent tool doctors have, insulin itself. Why does the book argue it's not the answer for type 2?
Well, simply put, if type 2 is a condition of having too much insulin already, the book's argument is that adding more through medication only exacerbates the root problem.
It fuels the fire, basically.
Right, kind of. The source cites the findings from the landmark UK PDS trial. This study showed that while intensive glucose lowering, which included insulin use in many participants, did successfully lower blood sugar levels.
Yeah.
It also led to significant weight gain, an average of nearly 9 pounds in the insulin group.
9 pounds, wow.
And crucially, unlike similar studies in type 1 diabetes, UK PDS showed no reduction in heart attacks or strokes in the intensively treated type 2 group.
So lower sugar but no better heart outcomes.
Exactly. The argument is that insulin forces glucose into cells that are already overflowing, effectively just hiding the high blood sugar in tissues, which then, as the book starkly puts it, rot over time, potentially worsening long-term organ damage instead of preventing it. It even mentions older animal studies that hinted insulin treatment might promote early atherosclerosis.
So the effect of giving insulin isn't clearing the excess sugar from the body, but just pushing it into already full tissues, potentially driving more damage down the line. What about the various oral medications used for type 2 diabetes?
Yeah, the source analyzes different classes of oral hypoglycemics. It points out that drugs which work by sourcing the pancreas to produce more insulin, like sulfonylureas, or by increasing the body's sensitivity to insulin's effects, like TZDs, they tend to cause weight gain. Worse, studies like UK-PDS show these classes often resulted in poor or even harmful cardiovascular outcomes. The book interprets this data as further evidence for insulin toxicity, too much insulin causing harm.
But there are some newer medications that seem to have better outcomes, aren't there?
Yes, absolutely. And the book contrasts the older drugs with newer classes that are weight neutral or even cause weight loss. And importantly, they work by mechanisms that reduce insulin levels or address insulin resistance differently.
Like metformin.
Metformin, for instance, has a relatively modest effect on blood glucose, but a substudy of UK-PDS showed dramatic reductions in diabetes-related death and heart attacks. Newer drugs like SGLT2 inhibitors, which cause the body to excrete excess glucose in the urine, have shown significant benefits in large trials, like MPA-REG, reducing death, kidney disease progression, and dialysis need.
Right.
GLP-1 analogs are also mentioned for their cardiovascular benefits. The crucial takeaway from the book seems to be that the drugs that reduce insulin toxicity seem to be the ones demonstrating real clinical benefits beyond just lowering a number on a lab test.
So it's not just about the glucose number.
It seems not. The conventional approach, according to this source, often creates a trade-off, reducing damage from high blood sugar, glucotoxicity, but potentially increasing damage from high insulin toxicity.
And the book also challenges the standard dietary advice and the role of exercise. It argues that low-calorie diets and exercise, despite their known health benefits, are not the answer on their own for effectively reversing type 2 diabetes, according to the book's perspective. Why make that argument?
Well, the source contends that the low-fat, high-carbohydrate dietary guidelines that have been standard for decades, particularly since the 1970s.
Yeah, the food pyramid stuff.
Exactly. It argues that advice was based on weak scientific evidence and has coincided precisely with the massive increase in obesity and diabetes rates. It highlights the fundamental flaw, really, in telling type 2 diabetics, who already have high blood glucose, to eat diets heavily based on the very food that raise blood glucose, the most refined carbohydrates.
It does seem counterintuitive when you put it like that.
And large-scale studies, like the Women's Health Initiative, where participants followed this low-fat diet, demonstrated minimal long-term weight loss and no significant reduction in heart disease.
And exercise. We all know exercise is good for us, but not enough on its own here.
While studies show exercise does have benefits beyond weight loss, sometimes reducing A1C, even without major changes on the scale. The book argues that formal exercise programs often result in less weight loss than expected. This is attributed to well-documented compensatory behaviors. People tend to eat more after intense exercise.
Right, that I earned this donut effect.
Kind of, yeah. And they also decrease their non-exercise activity throughout the rest of the day. These biological compensations can significantly offset the calories burned during structured workouts. This limits weight loss and, consequently, the potential for reversal if weight reduction is needed to sort of decongest the organs.
Okay. So if standard treatments and the usual advice aren't effectively addressing the root cause, What does the book propose as the path to effectively treat type 2 diabetes? It actually looks for clues from procedures like bariatric surgery.
Right. And while it's definitely not recommending surgery for most people due to its risks and invasiveness,
Sure.
the book analyzes why it is often so successful at reversing type 2 diabetes very quickly in many patients. The primary mechanism, it argues, isn't some mysterious hormonal change, but simply the forced, sudden, severe caloric reduction.
Just drastically cutting intake.
Exactly. This drastic cut in food intake provides the necessary relief for the liver and pancreas to decompress from the excess stored fat and sugar, allowing insulin resistance to decrease. This strongly reinforces the overflow concept. The key is actively emptying those overloaded storage tanks.
Okay, so emptying the overflow is key. How does the book suggest doing this naturally, without resorting to surgery? It champions carbohydrate-reduced diets.
Yes, the core principle for reversing type 2 diabetes, according to the book, is lowering insulin levels. While distinguishing between different types of carbohydrates, the source presents the avoidance of sugar and refined carbohydrates, particularly things like flour products, as absolutely central.
Cutting out the biggest insulin drivers.
Precisely. These are the foods that cause the fastest and highest spikes in blood glucose and subsequently insulin, driving the overflow and hyperinsulinemia. The book also makes a strong case for including healthy fats, noting studies that show higher intake of dietary fats from sources like olive oil in a Mediterranean diet are linked to lower cardiovascular risk and improved diabetes markers compared to restrictive low-fat approaches.
So, not afraid of fat.
Not healthy fats, no. The goal is to significantly reduce the main dietary triggers for insulin production and ectopic fat storage.
And the other key natural strategy discussed at length is intermittent fasting.
Yes, the book positions fasting not as a modern fad, but as the oldest dietary intervention known to humans.
Old school.
Very old school. It's presented as a natural and highly effective way to prompt the body to empty out that excess stored sugar and fat. The source notes that historically, pioneering diabetes doctors like Elliot Jocelyn, considered a founder of modern diabetology, used fasting as a primary treatment strategy over a century ago, long before insulin therapy was available.
Wow, really, before insulin?
Yeah. And what are the specific benefits of fasting, according to the book, that go beyond just simple calorie restriction?
Well, the source cites studies that directly compare intermittent fasting with standard caloric restriction. One study highlighted showed that fasting resulted in greater weight loss,
Okay.
nearly double the reduction in visceral fat, that dangerous organ fat, and crucially, it preserved lean muscle mass much better.
That's important.
Very. And, importantly, it did not trigger the field starvation mode effect of lowering basal metabolism, which can occur with chronic caloric restriction.
Why not?
The book argues this is because fasting triggers beneficial hormonal adaptations. Insulin levels plummet, which is the goal.
Right.
Noradrenaline rises, helping keep metabolism high, and growth hormone increases, helping maintain lean body mass.
Interesting hormonal shift. And the source emphasizes that reversal is often possible, though the speed and degree can depend on how intensive the fasting protocol is and, how long someone has had the disease. The book includes compelling case studies, individuals named Simon, Bruno, Ravi, and Betsy, who are presented as real-world examples of people successfully reversing their type 2 diabetes and coming off medications, sometimes even insulin, by implementing these dietary and fasting strategies, often within structured programs like those at IDM, Intensive Dietary Management.
The book does mention a phenomenon called the dawn phenomenon that can sometimes occur, particularly for type 2 diabetics, when they're fasting. What's that about?
Right. This is actually a natural part of our circadian rhythm, a surge of hormones like adrenaline, growth hormone, glucagon, and cortisol in the early morning. This prepares the body for activity by signaling the liver to release stored glucose. In type 2 diabetics, especially when the liver is still somewhat congested with excess sugar, and particularly after a period of fasting, this morning release can be more pronounced, causing a noticeable spike in blood glucose.
So higher sugar in the morning while fasting seems weird.
It does, but the book likens it to the sensation after needing to urinate desperately. When the dam finally breaks, there's a sudden rush. It's framed not as a negative event, but often as a sign that the body is successfully decompressing and finally able to mobilize and release that stored sugar.
So it's a sign of progress, potentially.
That's the argument, yeah. It shows the system is finally emptying, which is precisely the objective of reversal strategies.
And finally, the book reinforces that prevention is absolutely within reach, using these same lifestyle changes, pointing to studies like the China-Da-King study from the 1980s, which showed significant and sustained reductions in the incidence of diabetes over many years in groups that implemented diet and exercise interventions without relying on medication.
So our deep dive into this source presents a really compelling case for viewing type 2 diabetes not as an inevitable, irreversible chronic condition to be managed, but fundamentally as a potentially reversible disease of diet and lifestyle. The core issue, in this view, is insulin resistance driven by chronically high insulin levels, which results from the persistent overconsumption of refined carbohydrates and sugar, causing that cellular overflow we talked about.
The book effectively challenges the long-standing conventional wisdom of treating type 2 diabetes with low-fat diets and primarily focusing on lowering blood glucose with medication. It suggests that these approaches may have inadvertently contributed to the worsening epidemic by failing to address the root cause of excess insulin and the overflow phenomenon.
Instead, it advocates for strategies that directly lower insulin levels and allow the body to empty its excess sugar and fat stores. Primarily through carefully implemented carbohydrate-reduced diets that prioritize whole foods and healthy fats and the strategic use of intermittent fasting. This approach builds upon historical knowledge while integrating newer understandings like the overflow paradigm.
The book's afterword leaves you with a truly powerful sense of hope. The possibility of making type 2 diabetes and metabolic syndrome rare again within a generation. Using knowledge and lifestyle changes as the primary tools, rather than solely relying on drugs or complex procedures. It frames it as empowering individuals to regain their health and control.
Definitely a message of hope.
This deep dive has pulled out key information, including historical context and specific case studies from the book to give you a quick but thorough understanding of this perspective. It even points to resources like the sample meal plans in the appendix and the author's other book, The Obesity Code.
And here's a provocative thought for you to sit with, flowing from everything we've discussed today. If the evidence presented suggests that focusing on treating the root cause, hyperinsulinemia and insulin resistance, through dietary strategies like carbohydrate reduction and fasting, is so effective and grounded in biological principles, why does the conventional medical system continue to heavily rely on and promote older treatment paradigms that appear, by the book's analysis, to be less effective at achieving true reversal and preventing long-term complications? What does that discrepancy tell us about how difficult it is for established medical wisdom and practice to change, even when new evidence emerges?
That is certainly something to mull over. We hope this deep dive has provided you with some valuable insights and maybe a new, more hopeful lens through which to view type 2 diabetes.